ACL. In the video, he referred to the ACL's job as preventing femoral posterior translation. That is true in a closed kinetic chain situation, or it also, and more commonly, the tibial reference is referred to. So the ACL's job is to prevent the tibia from sliding anteriorly, or the femur from sliding posteriorly. It is just in the reference to the convex-concave rule, which one's moving. If it's convex on concave, the femur moves posteriorly. If it's concave on convex, the tibia moves anteriorly. The ACL's job is to check that anterior translation of the tibia so that your tibia doesn't slide too far forward. The PCL, and the ACL runs like this, inside the knee. So from the inner side of the lateral femoral condyle down to the medial side of the intertrochanteric area, intertrochanteric crests. So ACL kind of runs this way. PCL runs this way, goes from medial femoral condyle to the lateral side of the intertrochanteric area of the tibia. But again, neither one are palpable, but the PCL prevents posterior tibial translation or anterior femoral translation. So PCL is checking posterior tibial translation or anterior femoral translation. Okay? They both also limit tibial rotation. So if you have somebody who's torn their ACL, sometimes they'll get a rotary instability. It's because a secondary job of both the ACL and the PCL are to limit tibial rotation. Okay? The menisci, we're going to talk a little bit more about them. I'm going to kind of save it to the end as far as like their blood supply and injuries and that kind of stuff. But straight up palpating them, if you find your patellar tendon and you go off of that into the joint space, if you're in the joint space, you're on the edge of the meniscus. And then as you follow around, you're going to run into your medial collateral ligament and your lateral collateral ligament. So I feel joint space. If I'm in the joint space and I can push in there, I'm on the edge of the meniscus. But at some point I hit a roadblock. That roadblock is the MCL, or tibial collateral ligament, and the roadblock on this side is the lateral collateral ligament, or LCL, or fibular collateral ligament. And then if you come off of those, you can follow the joint space in the back, but it's a lot harder because you got to go through the hamstrings. So if you're asked to palpate the meniscus, I would palpate right in the anterior joint space, and you're on the meniscus until you run into the collateral ligaments. Menisci's job, there's a medial one and a lateral one, they're shock absorbers. That's their whole job, is to protect the articular cartilage of the ends of the femur and ends of the tibia and transmit force. They're shock absorbers. The medial one is